Good afternoon, everyone. My name is Jason Resendez, President and CEO of the National Alliance for Caregiving. I'm excited to welcome you to today's webinar, Gaps and Opportunities, Family Caregiver Programs in the U.S. Transplant, amongst U.S. Transplant Centers. This is a really critical time to be having this conversation about the intersection of transplant care and family caregiving. And the National Alliance for Caregiving has been a longtime champion for uplifting the voices, needs, and value of family caregivers across the healthcare system. Next slide. We are grateful for our partnership with Takeda, who made this work possible, along with support from our friends at Sanofi. Next slide. The National Alliance for Caregiving is a national system-based organization focused on shifting systems and systems of care to better recognize, support, and value the immense contribution of America's more than 53 million family caregivers. We do that by championing policy change, cross-sector partnerships, and research to help identify and address the needs of family caregivers. We bring together over 50 organizations from across society, from healthcare institutions to patient advocacy groups to financial service leaders, around initiatives to make caregiving more sustainable, more equitable, and more dignified. And nowhere is that needed more than within the transplant system. We are excited to share new insights in how the transplant system is in many ways stepping up in support of family caregivers, but in many more ways, not doing enough to recognize and address the needs of family caregivers across transplantation and transplant care. This is an absolutely critical time for this conversation as we see tremendous shifts in policy happening across family care more broadly, with the introduction of new payment reforms targeting Medicare to incentivize healthcare providers to engage and train family caregivers, a change that the National Alliance for Caregiving has long championed, and we're excited to see continue to build pathways to engage and train family caregivers navigating complex care. Over 60% of family caregivers are navigating complex and medical and nursing tasks as part of their care responsibilities. Transplantation is a great example of the complexity of care that family caregivers are often shouldering with limited support from the transplant health system and from providers. We also know within transplantation more broadly, we're seeing tremendous movement in reimagining what the system of transplantation looks like in this country from a policy and system change perspective. It's our view, along with our partners across the transplant ecosystem, that this change needs to take into account the needs and value of family caregivers in transplantation. And that's what today's webinar is all about. It's about lifting up opportunities for systems to better engage and support family caregivers, to share new insights, and to provide the experience, including the lived experience of caregivers who are navigating transplantation, to help us reimagine what the future of transplant care can and should look like, with family caregivers being a more integral part of that future. So with that, thank you so much for your time and for what you'll do to take these insights and put them into action. I'll turn it over to my colleague, Yadira.
Thank you, Jason. And I want to introduce Melina, who is part of the NAC team, and she's going to be sharing her story. So turn it over to you, Melina.
Good afternoon. As Yadira said, my name is Melina Pinedo, and I'm the Senior Manager of Health Programs at NAC, and I'm also a caregiver. I'm here today to share my personal journey as a caregiver during my mom's transplant process, an experience that highlights systemic gaps in education, training, and support for family caregivers in transplant care. gaps that many families like mine continue to face. But before we begin, I'd like to tell you a little bit about my mom. She was a firecracker, charismatic, ambitious, witty, intelligent, and kind-hearted. She was more than just my mother, she was my best friend. And at the end of 2017, she became seriously ill from unknown reasons. In early 2018, I brought her to the US for better care, but she didn't yet qualify for a transplant. In 2021, I moved her back to the United States for care, and within weeks, she was placed on transplant list. And this marked the start of an intense transplant caregiving journey, one that I was not prepared for. Just a few days after arriving in the US, my brother and I had to admit my mom to the hospital. Her hospitalization was not planned, and we scrambled to navigate the system. Our first challenge was enrolling her in healthcare. Even with a financial navigator, the process for Medicaid and disability was confusing and required us to submit multiple applications before she even qualified for those services. And while she was hospitalized, she started going under numerous evaluations to determine if she qualified for a transplant. But we received no preparation for the physical and emotional toll that these tests would take. A few days after completing most of the tests, we received a 2-hour education session, far too late to be helpful. The 2-hour education session was extremely overwhelming and did not provide any practical guidance for caregivers, such as managing appointments or post-transplant care. The sessions focused primarily on medical processes. So it focused on what it meant to be on the transplant list, the evaluations that needed to be done, things like that. And it didn't address the emotional or logistical challenges that caregivers face. Additionally, all the materials were provided in English, despite my mom's preference for Spanish. And this oversight left us without the full support we needed to navigate her care effectively. Shortly after, we attended a 30-minute nutrition session, which added even more stress. My mom, already emotionally drained, was faced with a long list of dietary restrictions and medication requirements, and watching her overwhelmed really broke my heart. Had the materials been culturally tailored, offering food suggestions that aligned with her preferences, or even provided resources in Spanish, it would have been a little bit more manageable. Once the nutrition session was completed, we were introduced to a social worker who addressed my mom's immediate needs. She ensured that my mother had 2 caregivers, housing, transportation, and time for appointments. But it was all patient focused. My brother and I were not assessed for the emotional, financial, or practical support we needed as caregivers. And this left us managing many aspects of caregiving by ourselves. Through personal research, I was able to find a caregiver support group and connected with another caregiver in the waiting room, which were both invaluable resources. But these connections came from my own efforts and not through the hospital. And it would have been really helpful if the hospital would have provided us with those connections or with someone who had walked the journey just to help with navigating a lot of the gaps that we were experiencing. As I became more and more involved with my mother's care, I realized that navigating the healthcare system often required more than just attention to medical details. It was about managing the constant stress, communication challenges, and fragmented care. For example, decisions among specialists often seem disconnected. One day, a specialist wanted my mom to have only clear liquids, then another day, they wanted my mom to have nothing but mouth. At one point, a doctor entered her room, unsure why they were there. And that just showed how disconnected her care team could be. And it was my responsibility to sort out these inconsistencies and really make sure that she was receiving constant care. Alongside these challenges, I faced financial and logistical strain. So I consistently had to go to the hospital, which had increases, paying tolls, gas consumption, and eating meals at the hospital because I spent long days by my mom's side. And an added layer was balancing caregiving and work. Caregiving often conflicts with normal work hours, as appointments and hospital visits tend to be during the day. While my employer was somewhat flexible, I still had to rearrange my schedule constantly and work weekends to make up for missed time. And many caregivers lack this privilege, and the strain of juggling both is really difficult. Sadly, my mother's condition worsened before she could receive a transplant, and she passed away. Even after her passing, systemic failures persisted. The day after she died, I received a call about an unpaid medical bill. a harsh reminder of how transactional the system can be. A month later, another transplant team called about her eligibility. Far too late. These moments underscore the inefficiency and fragmentation in the system. Reflecting on my journey, I see how much better it could have been with the right support. Caregivers navigate complex systems, applying to multiple transplant centers, managing insurances, preparing meals, ensuring medications are taken correctly, and even providing medical care. Imagine a system where caregivers only apply for a transplant once and hospitals communicate seamlessly. Imagine proactive caregiver support, someone to help manage the emotional, logistical, and financial burdens of caregiving. Imagine culturally responsive education tailored to caregiver needs and languages. When caregivers are properly supported, patients and their families thrive. Thank you for listening. Now I have the pleasure of introducing our moderator and the next speaker, Yadira Montoya. She is the Programs Director of NAC. Prior to joining NAC, Yadira had held leadership roles in academia, healthcare, nonprofit, and philanthropic sector. In 2019, she was recognized as a Culture of Health leader by the Robert Wood Johnson Foundation for her leadership in community efforts that improve aging equity and the health and well-being of the Latinx living with dementia and their family caregivers.
Thank you, Melina. And thank you for my introduction, but more importantly, thank you for grounding our conversation today. Your story really illustrates the many ways not only transplant centers fail to prepare and support family caregivers, but how these challenges are really exacerbated for caregivers and patients with different cultural and linguistic needs. I want to thank you for your courage and for your advocacy on this topic as well. So with that, I'm going to start my slide. Thank you, Amzai, for pulling that slide. Today, I'm going to delve into the key findings from our latest report, Gaps and Opportunities, Family Caregiver Programs in U.S. Transplant Centers. Before we delve into the data, I want to briefly discuss NAC's Transplant Caregiving Collaborative, which we launched in 2022. This initiative focuses on enhancing the recognition, inclusion, and support of family caregivers within the transplant system. Our research aimed to understand the current landscape of caregiver support across transplant centers and assess the availability and caregiver needs in terms of assessments, support programs, education, and training. And to achieve this, we conducted a 32-item questionnaire, online questionnaire with transplant staff. The survey explored caregiver needs assessments. Does the transplant center assess caregiver needs? Support service and delivery. What support programs are being offered? Education and training. What types of training and education? What are the topics that are being provided to caregivers? I also want to mention that we collaborated with Cole's Group to conduct this research, and that we work with an advisory committee representative of caregivers, patient advocacy groups, researchers, and different providers, as well as with different expertise on transplant care. And that this survey was adapted by a study published in the survey was adapted from a similar study that was published in 2023 about the availability of family caregiver programs in U.S. cancer centers. And some of those researchers who conducted that study were part of our survey review committee. We surveyed 143 individuals representing 114 unique transplant centers in the U.S. in the spring of 2024. Respondents included both support staff and directors of caregiver support programs. Here you can see the breakdown. The majority, in terms of transplant center types, the majority of the transplant centers we surveyed perform multiple types of transplants, And as you can see on this slide, kidney transplant programs were the most common. We also, not included in this slide, but we also aim to include transplant centers across all 11 OBTN regions, centers with both adult and pediatric transplant programs, and also to include institutions serving diverse patients and caregivers in terms of their socioeconomic background and geographic location, urban and rural. What we found is that most transplant centers reported offering between 2 to 4 support programs. This graph shows the types of programs that are being offered at the site and the percentage of of the centers who report these types of programs. And we define caregiver support programs as a structured, planned, and coordinated activities and procedures aimed specifically at supporting caregivers of the transplant recipients that was part of routine care in the transplant center. So we were very specific with this definition to include the piece about routine care. And so to exclude pilot projects, research projects that were more one-off. I want to highlight the good news is that 70% of the centers are providing some type of support. On the flip side, 30% said they had absolutely nothing to. They are currently not providing any type of family support caregiver program to family caregivers in their site, and we find that alarming. So we also surveyed the transplant centers on if you're not providing family caregiver support programs or expanding those support programs, what are the barriers that you are facing? And I want to pull up a Zoom poll because before I tell you the findings, I want to see what folks think are the biggest barriers to providing caregiver support programs that we found that the respondents in the transplant center reported. And I'll take just a quick 30 seconds, and if you fill out what you think we found, this would be great. I think the 30 seconds are up. Emsai or Lauren, if you want to. Great, thank you. So the top barrier that was, let's see, time limitations of current transplant center staff was the response that you all provided. And that is incorrect. What we learned is that 48% of the respondents indicated that the main barrier for providing comprehensive support included limited awareness about the caregiver needs. That was followed by financial constraints and limitations of current staff. So limitations of current staff was on the top, one of the top barriers, but not the top. Thank you for that. We learned that over 2/3 of the survey respondents said that their centers had a designated coordinator for caregivers. And when we asked who was typically responsible, they said an administrator, nurse practitioner, PA, social worker, or behavioral health counselor. Yeah, we found this quite interesting given the fact that limitations of current staff was a top barrier for providing services. It would suggest that there may be a lack of individuals available to coordinate caregiver care, and that it's really important that there's a designated point of contact for caregivers, which we pose as a recommendation, which I'll talk about in a bit. Despite the importance of caregiver support, there is a lack of a standardized process for identifying and assessing caregiver needs. In fact, only 58% of the centers reported having a written process for assessing caregiver needs. So let me repeat that once again. That means that 42% of the transplant centers said they had no written process. When we break down the responses, 27% said that they had no written responses and 17% said they were unsure. So that combines the 42. Of those who conducted caregiver assessments, they are being completed at different times during the transplant journey. I won't read this slide to you, but want to point out that they are more common earlier on the process. And I want to point out this last point about only 3% of the respondents reported that that caregiver needs assessments are being conducted at regular interviews. Instead, caregiver assessments are more often prompted by a negative event, whether it's a medical issue, complication, or an adverse event. Oh. If you're wondering how, oh, whoops. If you're wondering how we define caregiver needs, we compiled a comprehensive list to include the needs in terms of medical aspects of transplant, being one bucket, understanding the prognosis of the transplant, education, the necessary medical procedures, tests, etc. The second large bucket, understanding the scope and responsibilities of their caregiving role, coordination, and communication with the transplant team. Social determinants of health like transportation, housing, and employment, and caregiver self-awareness, caregiver self-care and wellness as the large bucket. While close to 60% of the transplant centers reported having caregiver-specific education and training, the training and education really varied again. It was inconsistent as well as being inconsistent. Here you see what is being provided and when. The most common type of education and training being provided is focused on the medical aspects, followed by the communication, coordination, and planning. And caregiver health and the well-being, what the needs are of the caregivers, was the least common reported. Education and training tended to be offered in tandem with the patient, and so it was done hand in hand. And notably, we found that caregiver-specific education and training was slightly more common in pediatric centers than in adult-only transplant centers. The survey also revealed disparities in caregiver support programs by race and ethnicity, which were magnified by income level. For example, we found that programs such as psychosocial support and financial counseling were less available in centers, primarily serving low-income populations, particularly Black and African American patients. This is an area that needs further investigation, as other research also shows that caregiver support interventions have been mostly developed and tested in homogeneous settings with primarily white caregivers, which really limits the applicability and effectiveness in more diverse populations. The survey also included questions about awareness of Medicare's billing codes for caregiver training services. As Jason mentioned, and while awareness of the CTS billing codes was high, utilization was low. This suggests a need for education and support to help transplant centers implement these codes and improve access to caregiver support. When we dug deeper into this data, we learned that the level of awareness really varied depending on the respondent's role. As you may remember, we surveyed both directors and support staff, and that also it really varied by type of center. So academic centers taking the lead in adopting and utilizing these billing codes. So our research findings, again, highlight the gaps in caregiver support, education, and training in transplant care. I just reviewed some of our key findings, but really encourage you to check out our full report. And want to leave you with these recommendations. In order to address the unique challenges of transplant centers, here are the key recommendations we've outlined. 1, implement a standardized screening process during the transplant waitlist or referral period to reduce bias and health inequities, and to identify caregivers who need additional support at the onset of transplant care. 2, standardize the process to collect and store caregiver data across transplant centers to improve coordination, continuity of care, and inform outcomes-based caregiver research. 3, integrate dedicated caregiver coordinators within transplant teams, to identify, address, and support caregivers and their needs along the transplant journey. 4, implement comprehensive, standardized caregivers support programs at transplant centers that are targeted, consistent, and evidence-based, and provided continuously throughout the entire transplant journey, from pre-transplant evaluation throughout long-term post-transplant care, to ensure that they are equitable and effective in supporting all caregivers. 5, conducting additional evidence-based research focused on the diverse needs of transplant caregivers from different demographic and socioeconomic backgrounds to address existing inequalities in the transplant system and research in this area. And 6, to promote the wide adoption of Medicare's caregiver training services, the CTS billing codes across all types of transplant centers to ensure to enhance access to essential training and support services for family caregivers. And as we go into our next section of the webinar, here is a question that I want to pose to the audience. And it is, what part of the report's findings do you believe have the greatest potential for advancing caregiver support in transplant care? Would love to hear your thoughts. And as a bonus question, not listed on this slide, is how can we work together to implement these recommendations? So I will drop that in the chat so that all those ideas and reimagining and collaborations, started collaborations can be listed on the webinar chat, and turn it over to the next section of our webinar. So we have a great lineup of speakers for you all. Can you go back to the slide, Emzai? So we have Marissa Argentina. Argentina is the Patient Programs Director at the National Kidney Foundation, a practicing licensed social worker. She oversees the National Kidney Foundation's peer mentoring initiatives, and she has provided oversight of NKF's peer support program since 2017. Prior to joining the National Kidney Foundation, Marissa worked as a dialysis center social worker in the Bronx, New York. After Marissa, you'll be hearing from Gloria Chen, who is a transplant social work supervisor at the Abdominal Transplant Center at the Del Seton Medical Center at the University of Texas at Austin. She has the privilege of working with transplant patients, donors, families, and caregivers, and is a member of the Society for Transplant Social Workers, the American Society for Transplantation Psychosocial and Ethics Community of Practice, and OPTN's Ethics Committee. And last but not least, you'll be hearing from Dr. Jeff J. Auletta, who is the Senior Vice President of Health Equity at NMDP and the Chief Scientific Director at the Centers for Internal Blood and Marrow Transplant Research. He is also the inaugural co-chair of the American Society of Transplantation and Cellular Therapy and NMDP's Access Initiative, an advocacy collaborative to reduce barriers to hematopoietic cell transplant and cell therapy focused on awareness, poverty, and racial inequity, and involving multiple stakeholders across the ecosystem. So you all are in for a treat. Marissa, with that, I turn it over to you.
Great. Thank you so much. And it's really quite a privilege to be here today and share a little bit more about the National Kidney Foundation's resources for caregivers. So next slide, please. We know caregivers are essential to those in the kidney community, supporting both kidney patients and those who want to become living donors. And they play a critical role in assisting those who are on home dialysis in the eligibility requirements for patients to be listed for transplant, as I saw some people bring up in the chat section, as well as supporting their loved one after transplant as well. And oftentimes caregivers are the ones really navigating the dialysis or transplant spaces, getting the education and creating a safe and healthy environment for their loved one to have the best outcomes possible. And NKF has really developed some resources to help support caregivers in a variety of ways, including providing education and a variety of ways to connect with others and provide support to learn about what they can expect from others who have been there before. Next slide, please. So I'm going to talk about a couple of our programs today. This program, NKF Peers, that's the program that I primarily work on, and it has really been a signature program of the National Kidney Foundation since 2011, when we started connecting people living with kidney disease who are on dialysis or living with a transplant with a trained peer mentor. And in 2015, our program expanded to connecting potential living donors with those who have donated themselves. And this year, we expanded our program to support caregivers and care partners of those living with kidney disease on home dialysis or who are a parent or a guardian of a child with kidney disease. NKF Peers facilitates one-to-one peer mentoring connections through virtual connections, either by phone or video chat. Participants can also communicate using our software platform or via text message. And peer mentors offer that unique lived experience that others might not have. Using our software platform, participants can connect conveniently and set up meetings to connect virtually, either by phone, video chat, Zoom, whatever might work for them. But we also recognize that access to the internet or, virtual might not be the ideal for folks. So mentees, those looking for support, certainly do not have to have access to that, and they can just sign up by phone with assistance by an NKF staff person, and we will instruct mentors to give them a call directly. We want to make sure that access is essential. And mentors and mentees are able to decide how often and how long they would like to communicate for. And we have periodic surveys that go out to request their feedback on that connection, how things are going, and if they do require any assistance. Mentors are also trained to escalate any issues to program administrators that they either don't feel comfortable talking about or feel that their mentees could benefit from additional education or resources. And we're able to follow up with those folks and provide that additional support, whatever that might be. Next step, please. Next slide, please. So all of our peer mentors undergo a very comprehensive training. First, with a self-paced online training that over video modules, which cover essential topics such as confidentiality, self-awareness, empathy, active listening, and maintaining healthy relationships. And then mentors are prompted to sign up for a live virtual Zoom training that really puts into practice the skills that they learned in the self-paced portion, where we can really practice in, providing feedback, we can have role playing, and they really get to exercise those skills in a place where, they can, get that feedback and not have to be perfect right away. And after they've attended both of these portions of the training, then they are given a brief written assessment, and that really provides some situations on how they would respond to various situations that they might encounter. Again, in that live training, it's really about crafting lasting impressions, identifying and responding to emotions that they might experience with their mentees. And we have a lot of role-playing situations since we know it can be a little intimidating to make a first call. And we also often hear feedback that this is the most beneficial part of the mentor training in their readiness to engage with mentees. And it's very important for me to note that mentors are specifically trained not to provide medical advice, but to empower their mentees to communicate with healthcare providers, to go back to those professionals, to ask questions or concerns. And those mentors can also escalate those issues to us as administrators for additional support as well. Next slide, please. So our next program at the National Kidney Foundation is NKF Cares, which is our toll-free information helpline. And we have specialists who can help answer questions related to kidney disease, dialysis, transplant, organ donation, and so much more. And additionally, NKF Cares can also help connect people with local resources that they might be seeking, such as transportation support, housing, or other financial resources. And we know that caregivers are often the ones navigating those additional support needs. So NKF Cares is open for anyone to call and get assistance, and specialists are available by phone Monday through Friday, 9 a.m. to 7 p.m. Eastern Time, and can be assisted in both English and Spanish. Next slide, please. The National Kidney Foundation also has a free online learning platform, which offers free self-paced courses for anyone to take. Courses are available both in English and Spanish and include kidney disease basics, treatment options, first steps to transplant, finding a living donor, and becoming a living donor. And we know that caregivers are often the ones seeking information and education to support their loved one, especially around transplant and especially around finding a living donor. And these courses are great resources that can be taken on their own time. They don't have to go to a course that might be held live on a certain day that might not align with all the other things that they have to juggle. We know that time can really be limited and precious. So additionally, at the end of all of these courses, additional resources are available to connect them with next steps that they might need to take. Next slide, please. And NKF also oversees several online communities that are available for caregivers and care partners to join. Community can be so important, especially when there are so many questions, and others may want to hear from people who have been in a similar situation to themselves. And these communities are free and available for patients, living donors, and caregivers to join, and we see a lot of them. All of these communities are monitored by NKF staff for quality of content and to provide additional support and resources as needed. They're forum style, so people are posting questions and responding to them and sharing their stories. And our current communities are based on kidney disease. We have a group for dialysis, a group for transplant, a group for kidney donors, a group for parents of children with kidney disease, and then we have a Spanish language community. Next slide, please. So looking ahead, NKF is really looking forward to joining forces with the National Alliance for Caregiving to really boost advocacy and support for the caregiver community, exploring various policy pathways to enhance transplant caregiver support and really leverage partnerships to improve resources for transplant caregivers. And my colleague Morgan Reed, who is our Senior Director of Transplant Policy, was unfortunately unable to join us today, but she's available to contact for any questions related to policy and opportunities to partner as well. And her information is here. And then how do you access, next slide, please. And then how do you access the programs that I mentioned earlier? So I wanted to just post the information here. Our website, kidney.org, has so much information on it related to transplant, related to caregiving, related to anything about the kidney community, but also access to all of the programs that I specifically laid out are here. And next slide. So thank you so much again for having me. My contact information is listed here should you want any additional information or discuss potentially partnering. So thank you again so much.
Thank you, Marissa. Next, we're going to hear from Gloria.
Hi, good afternoon, everyone. Thank you for the invitation and the privilege to share with you all about another resource for organ transplant caregivers and some research that my research team and I conducted on collaboration between dialysis and transplant social workers that can hopefully improve the care to not only patients, but also their caregivers. So first, I'm excited to share with you all about the Caregiver Toolkit, a transplant caregiver specific resource that was developed by the American Society of Transplantation and recently launched earlier this year. The AST Caregiver Toolkit was developed out of a response to calls from organ transplant caregivers for greater caregiver resources and education, similar to what we heard from Melina in her story earlier this afternoon. In February of 2018, American Society of Transplantation established the Organ Transplant Caregiver Initiative, which held a caregiver consensus conference, and from that formed an education subcommittee that developed the Caregiver Toolkit. This subcommittee was made up of 12 stakeholders representing the transplant providers, for example, physicians, social workers, psychologists, and caregivers. Each of the solid organ groups were represented. The subcommittee met bi-monthly, and an initial draft of the Caregiver Toolkit was created in July of 2020. Further iterations were developed until later that year when we extended the invitation to external psychosocial providers and additional caregivers to provide further input on the content of the toolkit. The final draft of the toolkit was then received and reviewed by the AST Psychosocial and Ethics Community of Practice, as well as the AST board in late 2021. And once fully approved, content was then reworked for literacy considerations. And so the content of the Caregiver Toolkit is divided across several different sections between generalizable and organ-specific chapters. Within the generalizable sections, 3 subsections were created, including organ transplant caregiving, which discusses caregiver roles and responsibilities, legal and financial considerations for caregivers, and special unique considerations for caregiving. The second section within the generalizable chapter includes caregiver quality of life, which discusses self-care for the caregiver and relationship dynamics between patients and caregivers that may be experienced during the caregiving journey. And then finally, the third chapter are resources, which provides a list of caregiver resources and a guide of questions that caregivers can ask their transplant center and a transplant dictionary. An example of what you'll find in the Caregiver Toolkit is a chapter on caregiver roles and responsibilities. This section provides education to caregivers on the organ transplant process, what caregivers should know at each different stage of transplant, as well as their responsibilities before, during, and after transplant. This section concludes with providing caregivers insight into the emotions that their loved ones, transplant candidates, and patients may experience while waiting for or after receiving a transplant. A neat function of the toolkit is that each chapter can be downloaded into a PDF that can be emailed, printed, and given and shared with caregivers by providers and clinicians directly. The intention of this function was to make this toolkit as accessible as possible to caregivers. And of course, caregivers themselves can directly access the toolkit online. The toolkit also provides important psychoeducation to caregivers about stress and self-care. In the chapter on caregiver quality of life, there's sections pertaining to self-care for the caregiver that helps them to learn about caregiver stress. For example, from their emotions to physical sensations and outward behaviors that may be exhibited under stress. This section also shares about caregiver burnout, caregiver depression and anxiety, and the impact to relationships during caregiving. This section also provides education on how to cope or deal with caregiver stress, including identifying common emotions and healthy coping strategies for caregivers. An example of a section within the resource section is a downloadable PDF guide of questions for caregivers to ask their loved one's transplant center. This resource was developed so that caregivers could print and bring it along with them to their appointment. It serves as a helpful guide for caregivers to help them start considering what they might want to discuss with their transplant team. And then the organ-specific section chapters provide information about specific organ disease and what caregivers should know before, during, and after each organ-specific transplant. And as I shared earlier, the AST Caregiver Toolkit launched in February of this year. You can access it via the web at that given link, and we're excited and hopeful for additional iterations of the toolkit, including translating it into different languages and developing pediatric caregiver-specific chapters. Next, I want to share with you all about some research conducted identifying collaboration between dialysis and transplant social workers as a pathway for improving patient and caregiver care. While this may be specific to patients with kidney disease, we hope that this provides just one example of how collaboration across and within disciplines can help improve the pathway to care for both patients and caregivers. The only disclosure that I have is that the research that I'm about to share with you was funded by a research grant from the Society for Transplant Social Workers. As we know, the road to transplant has many pit stops, and from when a patient is diagnosed with CKD or end-stage kidney disease, they then receive transplant education, screening, and referral, which leads to evaluation and ultimately, hopefully, placement on the transplant waiting list. Along the way, dialysis social workers are the primary clinicians at key points, including providing transplant education, screening, referral, and re-screening or re-referral as necessary. Interestingly, dialysis social workers are one of the few specialty professions that have a Medicare mandate to provide master-level social work services to patients and are required to conduct a psychosocial evaluation and provide psychosocial services to patients with end-stage kidney disease. And so we undertook a parallel mixed method study to better understand the role of dialysis social workers in kidney transplant. We recruited and surveyed 27 dialysis social workers and interviewed 15 dialysis social workers exploring their roles in transplant. The majority of those surveyed self-identified as female, were white, and with a subset identifying Hispanic. And while the majority had more than 6 years of social work experience, most had less than 5 years of nephrology social work experience, with only a median of 2 years working at their current dialysis facility. Yet most described their relationship with transplant programs as either fair or good, and majority of them described the transplant referral process as somewhat easy. In our interviews with dialysis social workers, collaboration between dialysis and transplant social workers were identified as a facilitator to transplant. This theme was recognized by several dialysis social workers, interviewed as a key factor to helping patients access transplant, and was described by some social workers as, quote, "I really question the transplant social workers' ability to get to know the patients as much as the dialysis social workers do. But that's why they're so closely connected to us. They're always calling us and emailing us, and we know each other from professional groups we have together. Another social worker described this theme of collaboration as, quote, I feel like every patient, if they're going to require a social worker evaluation for transplant, it seems like the transplant social worker should be collaborating with the dialysis social worker on every patient. And so in conclusion, dialysis social workers facilitate transplant care for patients. These findings suggest that collaboration between dialysis and transplant social workers should be further enhanced as dialysis social workers know their patients well and can improve care coordination by helping transplant social workers better understand a patient's social context, including their caregiver support. I appreciate the opportunity to share with you all about the AST Caregiver Toolkit, as well as the research between identifying collaboration between dialysis and transplant social workers as a key component to facilitating transplant care. Now I want to turn it over to Dr. Jeff Auletta, who will share further with us as well.
Great. Thanks, Gloria. All right. Actually, you can go ahead and advance. All right, so my name is Jeff Auletta. By background, first and foremost, I wanted to thank Yadira and Jason for the invite. This is such an amazing organization, the National Alliance for Caregiving, and it's been a pleasure to really partnership with your organization. As background, I'm a pediatric bone marrow transplant physician. So in other words, I would be in charge of children who have cancer who need a stem cell transplant, or even children who have sickle cell anemia as well. So next slide. So with regards to access, the Access Initiative is a collaboration between two organizations, the ASTCT and the NMDP. And I am the inaugural co-chair along with my other counterpart, Dr. Stella Davies from Cincinnati Children's. And the reason why we came up with this is this slide. There are many access barriers, whether that be to hematopoietic stem cell or bone marrow transplant or solid organ transplant. I think everybody on the line could nod their head on this slide in terms of the entanglement of these factors. So in other words, it's just like a spider web. When one of these factors are involved, the whole spider web collapses on itself. For example, social determinants or drivers of health. People with low socioeconomic status, they often are either have limited representation in clinical trials or they have caregiver barriers, which this whole seminar is about. So again, there are many factors which impede access to transplant, and that's why we started this initiative. Next slide. So there are two partner organizations, the American Society of Transplant Cellular and Cellular Therapy. So that's a provider organization. In other words, myself as a bone marrow transplant physician, this is my society membership. And then the NMDP, which is actually a mission of providing cell therapy for all patients. And so we do that by matching patients on their address labels in terms of these proteins called HLA that are expressed. And we are the organization that provides the donor for the patient who often needs to go outside their family in order to get a stem cell transplant. So in other words, there's a 25% chance of finding a related donor in the family. So there's a 75% chance of needing someone else's stem cells. We're the organization that provides that. Next. So the point of the Access Initiatives is to reduce barriers to stem cell transplant cell therapy by implementing changes in practice and policy, really to drive active, sustained engagement to the cell therapy community. And we want to do that by advancing, measuring, sustaining progress. And as was mentioned, we have three focus areas: awareness, poverty, and racial inequity. And we are not kidding ourselves, nor do I want to kid anybody on here, that these are entrenched problems in our healthcare system. In other words, we're not going to be the solution. We're going to be a part of the solution. But really, inaction is inappropriate right now. We know that there are many issues in terms of outcomes after transplant that really have to do with just being unfortunate in society, whether that be born in an inner city or being a person of color, or not having the right access or zip code in terms of where you live. And that just can't go on in our country of America anymore. Next slide. So with regards to that, of these 2 or 3 committees that are listed here, we have an ASTCT co-chair and an MDP co-chair. And we actually just started this junior faculty immersion program where we're teaching the next generation of physicians about these issues and teaching them how to advocate for their patients. Next slide. And so if you want to learn more about this, we have a website, the Access Initiative. You can just Google ASTCT and MDP Access Initiative and learn more about this. But the whole point is each and every one of us have a kind of a moral obligation to instigate social change when it comes to access. In particular, with regards to us as physicians or caregivers, in terms of the academic setting, we all need to come together to really address these systematic issues. Next slide. So I mentioned about the Access Initiative having some of these initiatives, and I wanted to drill down on our Caregiver Reimagined project, which is supported by PCORI, or the Patient Centered Outcome Research Institute of the NIH. Next slide. So when we think about requirements and challenges, I'm not going to go through everything that Yadira just did, or Gloria even, or the previous speaker as well, but suffice it to say that we have these requirements where we're not quite sure where they came from. And in addition to that, we're not quite sure the research that backs them. And because of those 2 things, they really become access barriers. In other words, transplant centers will say, hey, do you have a 24/7 caregiver? And if you don't, your patient may not necessarily get a transplant because of those barriers. And in fact, we know that caregiver requirements are an equity issue. And we've heard from Melina, for example. It's heartbreaking to hear that. But we know that we have to address those types of issues because race and even age and income become constraints in terms of the caregiver requirement. Next slide. So again, a complicated slide, but it's a complicated picture. In other words, the point is that there are issues inherent to the patient, but the caregiver is a shadow of the patient, right? The shadow has to do with there being a primary person in focus that needs a transplant. And the caregiver is often the reflection of the needs of the patient. And he or she then have to have double duty, as Melina was just mentioning, in terms of looking out for their family or providing for their family and the patient. And then other factors in terms of finances and jobs and health literacy, as Melina had mentioned in her example. So next slide. So again, Yadira did a nice job in terms of reviewing this, but it's a great report. You can get it. I know it was in the chat box in terms of being able to download this in terms of key insights. So next slide. And they also have a follow-up report in terms of the caregiver recommendations. And I really wanted to touch base as to where this project is coming from. Again, this was a separate work done by NAC. But we want to address many of these points. We want to address standardized screening process. We want to address comprehensive support programs. And we want to conduct research in terms of being able to provide the caregiver with the amount of support that he or she needs. Next slide. So this is where the Reimagined Caregiver came into play, and we wanted to engage the community that we have put together through the Access Initiative to really address some of these caregiver requirement barriers. Next slide. So our problem statement is just as we've kind of reviewed and all the other speakers have touched upon, and that is the current caregiver requirements for stem cell and even cell organ transplant create barriers to access. And those barriers need to be reduced in order to provide support not only for patients, but their caregivers as well. So we envision an equitable patient-centered model for stem cell transplant that meets the unique needs of diverse patients and minimizes burdens on family. And we really want to establish a support system that ensures safe and effective post-transplant care for every patient. So yes, it's a lofty vision, but one that we think is definitely necessary. I know that NAC would definitely agree with that. So next slide. So we have a couple aims for this project. Again, it is supported through the Patient Centered Outcomes Research Institute, or PCORI, their Eugene Washington Engagement Award. So we want to definitely recognize PCORI for their support for our project. Our first aim is to engage a diverse group of stakeholders to promote discussions The second one is to prioritize research questions, interventions, and engagement plans. And the third is actually to promote the agenda in order to sustain the progress for the program. Next slide. So we had our first workshop that is circled here, but this is all the work plan that has to do with this. And I want to touch upon two things. For PCORI, they're very interested in patient-centered outcomes research, or PCOR-E, or PCOR rather, and then the comparative effectiveness research model, or the CER. So those are the definitions that you see in this. But suffice it to say that basically means focusing in on research questions, approaches, and outcomes for patients. Next. So we had a engagement from multiple stakeholders as listed on this slide in terms of the spoken wheel model, but really a tip of the hat to NAC for being involved, as well as LLS, American Cancer Society, and Association of Oncology and Social Workers. Next slide. So together, this group engaged in our first workshop was on October 3rd and 4th in Minneapolis. And these are just some snapshots of everybody who's participating. Next slide. What the group did, both individually and as a group, is came up with ideas and summary ideas, both in terms of advancing post-transplant care support for caregivers, but also identifying possible blockers of that vision as well. And then also some learning opportunities and appreciations along the way, or insights that we've learned from one another. Next slide. So with regards to the first workshop, there were topics of interest identified by participants. Those are listed in the colored bricks as you see there. And then also with regards to that, we've came up with a vision for safe post-transplant care to support caregivers and patients, as well as those blockers that I mentioned. And since the workshop, there's been a Reimagine Caregiver Toolkit that we've provided to workshop participants as well. Next slide. So again, I just wanted to recognize all the people who engaged and participated in our workshop. We're again going to have another workshop in May of 2025 and continue to maintain that sustained engagement of those who are participating and the organizations that they represent as well. Next slide. So in summary, with regards to our Reimagine Caregiver Together, we want to engage key stakeholders to invoke change, specifically with regards to caregiver barriers for stem cell transplant, but certainly these can be applied to solid organ transplant as well. We want to define a research roadmap, and we're well on our way with that, utilizing the PCOR and SIR methods through PCORI. We want to empower stakeholders to take action. So we know that, again, this is an issue that's going to take a very long time in order to get right. But that doesn't mean that we can't have wins along the way. They're going to make momentum and continue momentum in a positive direction. And lastly, again, as I alluded to, we want to drive long-term impact. And so we want to come up with a way or a model in which all patients and all caregivers, irrespective of race, ethnicity, and socioeconomic status, can gain something from our initiative by coming together as multiple stakeholders to drive system change. So next slide. I'm honored to be the face of this presentation, but I want to recognize that there are many people involved in this, the team members that are listed here, some of which are participating as well in terms of listening on. And without their support, we certainly would not be where we are today. And again, next slide. I would definitely want to recognize the National Alliance for Caregiving and all the other nonprofit organizations who are participating, because without your support, we really can't drive that system change that I alluded to. So thank you very much.
Thank you so much, Jeff or Dr. Aletta. Thank you, Gloria and Marissa. We wanted to share how all of us are helping contributing to the research, to the practice change, to sharing our lived experience, to providing the support through patient advocacy organizations. And so it was really important to have the different perspectives in the webinar. We do have a few minutes for questions, and I If you haven't submitted a question yet and want to, please do so in the Q&A session. We did prepare some beforehand. And I want to, the first question that I wanted to pose was to Melina, and specifically, what aspects of the report resonated the most with your personal experience? Would be great to hear. And then I have another question queued up for Jeff.
Yeah, great question. For me, it was definitely the cultural competence aspect. If the resources would have been provided in Spanish, for example, it would have allowed me not to focus on having to translate and like jumping those hoops and making sure my mother understood everything that was going on. So yeah, that's what.
Thank you. And thank you for keeping it brief. I'll ask the same thing so we can hear hopefully from the rest of every one of the panelists and the questions. The next one is for you, Gloria. And thank you for sharing the Caregiver Toolkit. It's an amazing resource. I'm curious about looking ahead. You mentioned there's going to be different iterations. I just want to learn more. This seems to be like a really needed, but also unique resource in this particular space.
Yeah, thank you so much, Yadira. And it's been a years-long task. It started several years ago, and we were able to get through it even despite COVID. The next iterations that we are looking forward to and that we're starting to work on now are pediatric-specific sections. And we are also hoping to translate the toolkit into different languages so that it can be accessible to people who speak different languages.
Gotcha. Thank you. We're definitely looking forward to that and helping you disseminate that great resource. For you, Jeff, you already started to talk about that. You weave this question into your presentation, but it is around what are the key takeaways from the reimagining the caregiver project that transplant centers can start implementing right away. And I think that you keyed into the pieces that are universal both for solid organ and stem cells. So I'm going to broaden this question and just kind of hear your take on kind of what are the most immediate caregiver support programs, education, and training that you see on the stem cell and the bone marrow transplant side.
Yeah, great question. So I think that the first thing is just putting the resources together, right? In other words, is the awareness of resources that exist in multiple different areas. I think it's one of those things where, again, if you're not touched upon this, you have no idea about the need, but once you are, it's difficult to find, right? And no one social worker, he or she doesn't necessarily have all of these resources tucked into their favorite web page where they direct patients to. So we really have to kind of pool resources and sites and be able to direct patients and caregivers to common sites of resources. So I think that that's one thing and a low-lying fruit, to be honest with you. I think the second thing, though, is learning about what those needs are. Now, again, with your organization, Yadira, you obviously have the recommendations and the background there. I think it's still that sustained engagement of caregivers themselves, which are going to enlighten us as those who are going to be able to help them the best. So it's getting their feedback along the way, this entire process, so that we're not designing something that looks good to us, but practically is not going to be helpful for a caregiver.
Yeah, thank you. And I can't agree with you more in terms of at NAC, we plan and work towards having being caregiver centered in all of our work, definitely in our mission, but in our projects. That's why we had the advisory committee and really start these webinars, grounding our conversation of what is the lived experience? What does this look like for transplant centers? And can't wait to expand on that and collaborate with you so that we can continue to really uplift the experiences of family caregivers in both solid and stem cell bone marrow transplantation. And then just very quickly, I'll ask for brevity, Marissa, your question is, how does the the Peers in Care program at the National Kidney Foundation have the potential to address the gaps highlighted in the report? Again, you touched on this a bit, but just want to give you the last remark so that you can answer that question.
Yeah, I think it goes back to kind of that equity and access and making sure that our programs are culturally tailored and making sure that we are meeting people where they're at. So similarly, when we were developing our expansion for the program for care partners and caregivers, we had an advisory committee of caregivers that fit all of kind of who we wanted to serve in the program. And in all of the work that we do, we try to really have those voices come through so that we are meeting the people where they need to be.
Thank you for that, Marissa. I think that's a great way to end, meeting family caregivers and patients where they're at. And with that, I want to thank you again, Emza. I'm going to ask you to pull up our last slide. If you want to learn more, here are the QR codes for 2 reports. The first one, the latest one that I presented on the gaps and opportunities, that's what we released a couple of weeks ago or last month. And then the transplant caregiving in the U.S., a call for systems change, which we released last fall. And I would be remiss if I didn't thank our sponsors again, Takeda and Sanofi. Thank you all so much. We will be sharing the slides afterwards. Follow us on social media if you don't do so already. And we will also be putting this recording of the webinar in our YouTube channel. Again, thanks everyone, and for joining us on this important conversation.
Thank you for having us.
Thank you.
Thank you.